11th of July every year is observed as World Population Day. And all that we try to do is to bring attention to key population issues that affect our development group. So every year we look at an issue, a burning issue, and use it as the theme. This particular year, we have been faced with COVID-19. And what we know is that it's not affecting everybody in the same way. The needs of women are different from men, and it appears their health needs and their rights are being impacted in one way or the other. So this year, the team is putting brakes on the COVID-19, how to safeguard the health and rights of women and girls now. So today we are meeting to share the same message with our partners and look at how the impact is being felt in this region of ours with respect to the areas that each of us is working in. So that is why we are gathered here this morning. And once again, I want to thank you very much for making time.
Teenage pregnancy already there, unsafe abortion, misconceptions regarding family planning, which leads to low acceptor rates, child marriage, sexually transmitted infections, and so on. They were already there. Now, when COVID set in, it worsened the whole situation. So already the problem we're dealing with is like times 2, times 3 now in COVID era. And one, of course, the virus has no respecter of sex. It doesn't care if you're a male or female. It doesn't care if you are old or young. But if we look at the situation very well, we realize that women and girls are mostly affected by the situation. How? If we look at the frontline workers, for instance, women form majority of the frontline health workers. Women are in the majority. And so once frontliners already are susceptible to infection, and there are cases where even doctors, nurses, other health service providers contract the virus despite all the measures that they put in place. And if women are in the majority, then you can tell. And then when it comes to sexual and gender-based violence, that has also gone up because of the lockdown situations, because of the fact that schools are no more in session, so majority of students are at home, and more time is spent at home with families, with friends, and so on. So that also increases the vulnerability of women and girls when it comes to sexual and gender-based violence issues. And then 60% of women work in the informal economy and have felt the heat more because patronage, economical situation have changed because of COVID. COVID has actually affected a lot of things, and those in the informal sector are not left out. Then increased workload for women at home due to the COVID situation. So again, women would have to take care of the children who are now at home, whom under normal circumstance would have been in school, spend more time in school and then come home. Now they are at home. And for those who are even doing their homework and most of these things, most often than not, it is the women who have, in addition to their normal domestic responsibilities. So it would increase all of this. And then dependency ratio have also gotten worse because now people who were initially working are no longer working. Some have been fired and some are on standby because where they work are running a shift system. So they are just working with some few, and the rest are on hold till the situation settles down. And they are not being paid. Most of them are not being paid. Just some few who are at home and are still being paid. So they are okay. So those who have lost their job, those who are at home because all of them cannot come to work, and market is not good. So if all of them come, the employers cannot pay all of them. And so these people who were initially working now would have to find a way of surviving and have to depend on other people. So the few people who are working will now have very little to spend on themselves and spread it across to those who are not working. I don't know about you, but most of my friends, people I know, keep calling like they haven't eaten, they haven't done this. It's becoming common. Reproductive health needs of young people has also been an issue because of COVID, and is pushing most of them into adopting behaviors that under normal circumstance they wouldn't. But because of this situation, it's pushing them and it's endangering their lives. Now, what is PPAG doing in the face of all of this? We have organized community outreach activities in some selected communities because when the situation set in, we realized that our client flow went down drastically. And when we reach out to some of our clients, they had some fear that when people are ill or get infected, they go to the health facilities. Therefore, if they go to the health facility for other services, the possibility of they coming into contact with somebody who is infected is high. And so, though they have need for services, the situation deters them from accessing the services. And so that informed our decision to increase our community engagement and outreach and provide free family planning services to those who cannot, because already they are spending more time with their wives, husbands, girlfriends, boyfriend, and so on. And so if they are not protected, then it means that if we have to wait till COVID is over, which nobody knows when it will be, then it means that we'll have increased rate of so many things. And so that informed the outreach. And of course, we went house to house visits, because not even all of them would like to come to the outreach ground. So we had some volunteers who were reaching them at their various home shops and so on, distributing male condom, female condom, and also educating them on COVID-19 so that they can have some belief in the health system, and also tell them the measures and protocols put in place to ensure their safety if they come to the facility. And as we move from house to house, we were also educating them on the DOFSO hotline, so that those who are having issues with regard to sexual and gender-based violence can reach out to DOFSO and seek help. And then we also embark on livelihood skills training. Like I said earlier, the dependency ratio was becoming worse, and so we thought it wise to empower some of these adolescents in how to make liquid soap, detergent, soya beans, kebab, and so on, so that they can produce and sell and make some money for themselves. And some of the communities we went to that benefited from this training is Abra, Nkamfwa, Emisechi, Apeuska, Abakem, Komenda, and then Kisi. These were the communities we went to for these sessions. And then we also realized that young people, mostly the adolescents, were vulnerable when it comes to the infection, especially among the street hawkers, those who hawk around the market centers, because it's also a densely populated area. If there's any outbreak, it can spread faster. And we realized that most of them, their parents push them out there to go and sell, but they don't provide them with even face masks, and they move around the market centers and areas without them. So we also procured some face masks and distributed free for these young people who were walking on the streets and in the markets. And we also increased our media publicity, educating people on COVID and also encouraging them to visit the facility for health services. So we use radio and TV for that. And then we also realized that the issue of sanitary pad also was pushing some of these adolescents into behaviors which were untoward. And so we distributed free sanitary pad because there were instances where people were exchanging sex for money in order to buy sanitary pad. And interestingly, I never knew this, but now they sell the pad, single one, not a pack. They sell the single one because, of course, once they are selling it that way, it means that they also know that some people cannot afford the full pack. And that should tell you, if somebody is not able to buy that single one, what happens? And nobody wants to soil his or herself and be in that position. And so it pushes a lot of them to this kind of behavior. So we educated them, and then we also distributed the pad, menstrual hygiene, and so on. So we went to different communities and did that. And then finally, we also embarked on what we call the back to school project. Unfortunately, some students got pregnant during this era, and some of them were supposed to write their final exams, which have started already. And because of the COVID situation, of course, Ghana Education Service has a policy now that you can go back to school. But because of COVID, it changed a lot of dynamics. And the school are scared a little bit as to having the pregnant lady. Already, the pregnant lady is vulnerable. And the COVID situation too, people are not so conversant and okay with it. And so the girls themselves, some of them were not ready to go back to school because of the situation. And then the school authorities were also in a dilemma as to what to do with these girls. And so we had to step in, and we made a call for those who are in that situation, who are pregnant and want to go back to school. We had a series of counseling sessions with them in their homes and encouraged them to go back to school. And we actually took some of them back to school, engaged the school authorities, and they've been accepted. Interestingly, some of them were in their final year, and they have started writing the papers. One even delivered 2 days ago, but Monday she'll be writing the integrated science. But she's okay, she's fine, and that's it. Basically this aside the clinical services that we run at the facility, these are some of the things that we have done.
In close contact, the probability of violence and conflict is high. And so, being locked down at home with our children, definitely some of the children will do things that will get parents worked up. And so, you see, some parents may end up abusing their children. However, there are a few things that so far with the COVID-19 has come up. Globally, it has been said that COVID-19 has doubled sexual and gender-based violence. With areas like UK, they said they've increased by 120% and all that. But I also want to state that in such a situation here, we only need data to compare to be able to state that fact, which currently I don't think we have done. Now, some of the areas that COVID has affected sexual and gender-based violence. One, economic hardship. As a result of economic hardship, parents leave home. Some parents leave home to look for money for survival. And so their children are left in the care of nobody and exposed to abusers. I have had the unpleasant duty to hear some of the stories coming from communities where some girls have even been impregnated by tenants in the home as young as 14, 12, and all that. Aside that, as Michael said, we have also heard issues of transactional sex by some little girls just to survive the COVID economic hardships. Those are practical issues that are coming from the field. Now, with the economic hardship and children being at home, some parents also see them as cheap labor. And so we see a lot of these children hawking around in the street, mostly without any face mask that exposes them. The most dangerous aspect is that they may be exposed to sexual predators whilst hawking. And then another issue that has come up during this period is that the children are home. There are a lot of online learning avenues that has been opened for them. But the issues coming is that most of the girls are overburdened with the household chores, and the boys get the opportunity to follow these learning processes. And so by the time we are all through with this COVID-19, you realize that a lot of these girls, their learning may go down. And it's a real issue if we are looking towards 2030. Now, another issue that has come up within this period, that both globally and locally those issues are coming up, is incest. It has been in the media and a few people talking about here and there. Children are at home. Here too, before the COVID-19, the children are out there doing all sorts of things. Now, big brothers are kept at home with small sisters. And if they are not able to go out, where do they practice their sexual escapades? And so some of them may end up abusing their younger ones, girls. So those are some of the areas that we need to pay critical attention to. And then, fear of accessing reproductive health services. I'm happy that all the services have opened up now by Ghana Health Service. But the fear of contracting the disease may prevent some women and girls from accessing the services. And so, apart from opening up, I think we need to do extra. Those of us in the social sector, we need to do extra to encourage the women to access these facilities. Otherwise, at the end of the day, we may be looking at high rates of mortality and all that for especially pregnant women. And we've been here and we've heard some women even go to the hospital and are not attended to because they had difficulty in breathing or something. And so all these bottlenecks, if not addressed, can affect gender equality within this period. Now, I want to look at what we are doing as a department. Prior to the COVID-19, we have been doing a lot of engagements. And we know that the COVID-19 has disrupted our engagements. However, there are some key areas that we think if we focused on can help us maintain some level of results within the community. Before the COVID, the department had a number of community parent network advocacy groups. And this year, we decided that we wanted to empower and expand it so that at least we can have it in more communities and they can take the issues of parental responsibility seriously and protect their children. And so this year we've trained additional parents to be part of the network. Apart from that, the existing community parent networks, we also supported them to do sensitization virtual on their community information centers every week to ensure that information on sexual and gender-based violence, on women's reproductive health and rights are given out. At least every week there is some level of information within the communities where we work. We also have an ongoing weekly radio discussion program on sexual and gender-based violence, child marriage, and all reproductive health issues. Then we also looked at how to engage apart from these traditional methods. And so we decided to develop social media campaign messages that we share to educate the public on these issues. Now, Michael talked about PAD, and for us, every year we have the mentorship program. This year, looking at the unique challenges that some girls may encounter, we have made a proposal that we want to support some of the existing mentee communities by supplying these girls, over about 500 girls, with pads, sanitizers, nose masks, and all that to cushion them. And we have termed this the Home Project, Hour of Mentorship and Empowerment. So this quarter, we'll be rolling that out. We'll be visiting the communities, engaging the girls and groups, and also the boys. We are not leaving the boys out. We want to engage them to understand the issues surrounding incest and SGBV. So basically, those are some of the things we are doing. And we hope that as the situation gets better, we will fully resume our engagement so that the reproductive health and rights of women can be protected. To end my statement, I will say that in this era, more than ever, we need to enhance our gender disaggregated data collection to help us understand the issues and program properly so that we can all come on board and address them. In this age, you cannot talk without evidence. And so for all the institutions that are gathered here, we need to enhance our data collection, gender disaggregated data collection, to ensure that we have the information to act and to do what we have to do to protect our women, our girls, our men, and our boys. Because whatever affects women also affects men, and whatever affects men affects women. Thank you very much.
Have already been shared by the previous speakers. But for the avoidance of doubt, permit me to read what I have before me. The laws of Ghana safeguard the dignity of a person and the equality of both men and women, including children. This is central to gender equality and its mainstreaming. The age of COVID-19 presents an occasion to demonstrate society's effort at bridging the gap between men and women in all spheres of life, because it makes sense to fight the common enemy with efforts devoid of discrimination. The pandemic has occasioned the mandatory wearing of face covering, stay at home, work from the home, a ceiling on the participants at social events, and the discouragement of unnecessary movements across borders, to mention few. Many have lost their jobs, in-person school attendance suspended. Persons with underlying health condition lose heart and generally creating hardship here and there. The effect on girls and women in Ghana are listed below or are discussed below. Positively, lockdowns and stay-at-home measures have the potential of solidifying weak family bonds and repair broken homes. An ideal home, you all know, is one with regular presence of a father, mother, and other householders. The togetherness may provide an avenue for a healthy resolution of conflicts unresolved due to the absence of one of the parties. Children would have the space to share quality time with their parents and seek answers to questions bedeviling them. Previous school homeworks will be revisited and any improperly done ones corrected. Assessment of one's world academic performance and the required motivation to reach the next level become handy. Householders will have the time to take stock of common social and economic activities, embark on, and seek to build bridges. The conducive environment will quicken personal growth and development of the individual members of the family. Unfortunately, women and girls across the globe form majority of survivors of abuse of all forms. Economic, social, cultural, and psychological controls are among the causal factors to the commission of crime. If these considerations are aggravated by the hardship created by the pandemic, then an upsurge in assault, battery, sexual offenses, threat of harm, non-maintenance of a ward or spouse is possible. Depression, anxiety, or met needs create quarrel and hostility among householders, underscoring the commission of domestic violence. Non-maintenance and assault form majority of statistics of the domestic violence and victim support unit (DOVSU) of the Ghana Police Service. Most of the survivors are girls and women. The space is constantly being monitored to ascertain if the pandemic has resulted in a sharp rise of reported domestic violence instances in Ghana. So for now, statistics is not complete to contribute to any declaration, and I agree with Madam Gender. Conflict is imminent in situations of unfair distribution of personal protective equipment, PPEs, at the family and community level. If one householder is given too many of the products, the other will cite favoritism. Children may be less likely to have face coverings because a parent may choose to attend to an adult householder before turning to the child, which may even not happen at all. If you go to most homes, children are not wearing face coverings because we see them as not important, including women. Some men will buy their proper nose masks and keep them to themselves. Sometimes the wife will have to come and beg, "Oh, please, give me one of the nose masks," before the man will reason with the wife. So we are saying that unfair distribution of personal protective equipment can be a source of conflict at the family level. So please take note. A man who perceives house chores as the preserve of women is likely to overburden his partner, daughter, or housemaid with house chores. This is also a source of what? Conflict. You know, most people, because of our socialization, see house chores as belonging to what? Women. But now we are being asked to stay at home, work from the house. It means that the woman who is already a career woman will have to be doing other work from time to what? Time. And you know, when people stay at home, they eat a lot. You see? And they generate waste a lot. Because if the person was eating one kenke in the morning, be sure that by the end of the day, 5 kenkes will work. And you can see the waste that it will generate. And if we don't share this house chores, it means the woman, our daughters and our housemates are going to be what? Overburdened, and can be a source of conflict. Basic things. Children who find themselves in broken homes and in homes where either or both parents are mostly absent are likely to loiter in the central business district, that is CBDs, of the community they reside, and in the company of their peers engage in all manner of wasteful activities to the detriment of their growth and development due to poor parental control or supervision. These children are likely to be predisposed to potential criminals who might either abduct or engage them in unlawful sexual activity or both. Defilement, rape, teenage and unwanted pregnancy could increase due to the carefree lifestyles being pursued. Women in some situations, girls who double as breadwinners, are likely to struggle to provide the necessities of health and life to their dependents. Mostly we think that breadwinners are men. We also have so many men and even girls who are also what? Breadwinners. So with the economic crisis that we all face currently, chances are that these women will struggle to provide the needs of the people that look up to them. Child marriages and child trafficking could thrive in poverty-driven areas where their economic status and security have been aggravated by the pandemic. So we are also reminding you of child marriages and child trafficking. What we are saying here is that the observation is that in poverty areas, areas that have much poverty, the perpetrators go there and lure unsuspecting, children and parents to agree to their wishes. Overall, the health of the child and woman in the circumstances mentioned above is likely to weaken. Way forward, mature householders, both women and men, should share house chores, and particularly among boys and girls, to dispel the notion that such tasks belong to only girls and women. So let's begin to teach our children, boys and girls together. Now they are all at home. So there is no excuse that, one is at school or they are all at home. Let's take opportunity of the situation and teach them house chores together. Men are also not left out. If you're a man, you are at home with your wife. Don't overburden your partner or your mother or your sister. Share the house chores duties. I think we have to run home these things. In the long term, the stereotype will fade, giving meaning to gender parity and improve the health of girls and women. Number 2, employers who contemplate either downsizing their workforce or asking some to work from the home should not, without sound basis, target women. Now, employers are laying off workers. It is possible that if you're a woman, you'll be asked to go home first. For no sound reason, just because you're a woman. So, 5 people must go home. How many do we have here? 5 women. 5 men. Okay, let's ask the 5 women to go. What we are saying that there must be sound basis. The criteria, process, and redundancy packages should be fair and equitable. Number 3, let's support livelihood support initiatives in order to cushion those affected with redundancy programs in particular, and those already unemployed in general. This point has already been stressed by previous speakers. Number 4, let's resource frontline institutions in the fight against sexual and gender-based violence, in the likes of DOFSU, Department of Gender and Children, Commission on Human Rights and Administrative Justice, National Population Council, PPAG, and the regional coordinating councils being represented by Mr. Pence. Pence, well done. Etc. to discharge their mandated roles effectively. Logistics and manpower needed to carry on with their mandate should be made available. DOVSU recently took delivery of a laptop and 5 smartphones per funds provided by the United Nations Population Fund under the auspices of the Central Regional Coordinating Council to augment the communication system of the unit of the Ghana Police Service. We want to say DOVSU is indebted to UNFPA. We have done our bit to sensitize a number of people in the region over the years. If I'm not afraid, I would say we have sensitized over 5,000 people since 2010 on gender and sexual-based violence. On the law, the Domestic Violence Act 732, the need to desist from domestic violence. Over 5,000 people, if I'm not afraid, we have sensitized them. The whole region, the population is around 3 million. So if you have done 5,000, then you have to clap for us. Though there is room for improvement. We are resolved to carry on with our mandate. Mr. Population Council and convener of this meeting, we want to assure you we'll carry on with our mandate. And for now, if you have been hearing the perpetrators of rape, defilement, we don't do. We send them to court. Some of even yesterday, one was given 14 years imprisonment. So the police is playing it through, and we continue to say. I don't have any other thing to say. Thank you very much.
In this region, there's always a high rate of child neglect. And with this COVID, we are expecting that it will go up. So you're also finding a way to sensitize. Also, there's discrimination already, and the COVID is going to aggravate it. So you're also looking at areas that we can try and minimize. Because like has been said, there's this digital educational programs. Unfortunately, most people in the rural areas may not. Even those in the urban areas, I don't think they are benefiting. So the Cape Coast, around Smith Bowden, the children are always on the street. So you wonder whether they are benefiting from this program. Because of the COVID-2, Shraj is now receiving only critical cases. So when the case comes, we look at how critical the case is. Is it life and death issue? If yes, then we have to. If no, and the case can wait for some time, we advise the parties or refer them to wherever they have to. There have been some instances where there are issues about criminal cases. And because Shah doesn't have handle criminal cases, we either refer them to DOVSU or to the courts. One issue that we have realized that COVID has brought up fear in going to the hospital. I've been to the teaching hospital about twice, and you can see that even family members who normally sit just by the gate when you enter, the number has reduced. Even OPD has also reduced. So now it's going to affect our right to health. And we have been thinking about how we can at least alert people. When you talk to people, they'll tell you that if I'm sick and I'm in my house, I'm safer than to go to the hospital. So I'm happy that Ghana Health Service is also trying to find a way to at least manage it. Because it's our right to benefit. You have to benefit it. But if you are looking at COVID to push us away, then it's going to be a big problem. And once women are more than men, women have to give birth. So if people are not willing to go to the hospitals, now here antenatal people don't go. I hear even weighing, there's no weighing now. But what you go is that you go and take your shot and you go home. So I can see that there is going to be a big challenge. So we are appealing to Ghana Health Service. Let's see how we can manage it. On how to address this issue, you have seen that we need to respect the rights of women and girls. Because defilement, rape, early child marriage, and violence against women is because that we don't respect women as such. Someone gives birth and they ask whether it's a nipa or a girl. So our cultural practices have to change. So we are appealing to the media who are also here with us to see how best we can champion the rights of women. Let everybody understand that rights, women also have their rights. And if the men, we are enjoying our rights and women are not enjoying, the world will not be perfect. We also need them. And now there are big issues like Dr. just said. As we are in the house now, a lot of issues, household chores, difficult things are happening. And women are best managers of the home. You can't dispute that one. So if we respect our women, like the men, husband respecting the wife, it will transcend to the children, and that will also help. So Shiradi believe that we must all respect the right of women and the girl child, not forgetting the boy child too. Because at times we forget the boy child, and that also brings problems. Yeah, we also be partnering with gender for their road shows and community programs. And we are also willing and available every time to partner to champion the cause of women and children. Thank you very much.